Welcome to Pursuing Quality Long-Term Care, an educational podcast for individuals needing long-term care and their families. Join us as we talk with national experts and advocates about the strategies you can use in the pursuit of quality long-term care. Often, the conversation about addressing the chronic poor care that exists in far too many of today's nursing homes is framed around new laws and regulations. Yet, there are steps that can be taken now, such as using existing federal and state legal authority to improve care and conditions in our country's nursing homes. In our conversation today, we will discuss 4 levers of opportunity for increasing quality and accountability in nursing homes with Nina Kohn, an attorney, law school professor, and the author of Using What We Have: How Existing Legal Authorities Can Help Fix America's Nursing Home Crisis.
Hello, and welcome to today's episode of Pursuing Quality Long-Term Care. I'm Lori Smetanka, Executive Director at the National Consumer Voice for Quality Long-Term Care. Today, we are talking about opportunities for improving quality in our country's nursing homes. Often the conversation about addressing chronic poor care that exists in far too many of today's nursing homes is framed around needing new laws or new regulations. And while there are some things that will require or benefit from new legislative or regulatory action, there are things that can be done right now using existing authority to fix some of the problems that exist. And that's what we're going to be talking about today. Our special guest is Nina Kohn, who is the Solomon Center Distinguished Scholar in Elder Law at Yale Law School and the David M. Levy Professor of Law at Syracuse University College of Law. Professor Kohn is a leading authority in elder law and the civil rights of older persons. And she recently wrote, which is a really terrific article called Using What We Have: How Existing Legal Authorities Can Help Fix America's Nursing Home Crisis, published in the William and Mary Law Review. And I'm delighted to have you with us today, Nina. Welcome, and thanks for joining me.
Well, thanks for having me. It's a pleasure.
Well, as I said, this was a really terrific article that you wrote. And, let's get started by just talking very briefly and set the background about conditions in nursing homes and really set the background. Like, we know what happened during COVID, right? Where so many people died as a result of lack of staff, poor conditions, infection prevention failures that were occurring in these facilities. But these are not problems that arose during COVID. And that's what we've seen at the Consumer Voice. And isn't that what you've been seeing as well?
Absolutely. I mean, what COVID-19 did, among other things, is it exposed some of the long-standing problems that residents face in U.S. nursing homes, right? So, I mean, I don't have to tell you, Lori, that residents, ombudsmen, staff, those who study nursing homes, right? We've all known for a long time, for example, that nursing homes are understaffed. We've all known for a long time that many nursing homes just don't have enough staff to meet residents' needs, and therefore neglect is unfortunately common. But I think what the pandemic did in part is it made that more visible, right? Because we saw how lower staffing levels, for example, were associated with reduced ability to control that COVID-19 outbreak risk, reduced ability to avoid fatalities. And of course, the media was full of some truly horrifying stories, literally bodies piling up in some of these facilities. So it made these problems more visible. But really what we're doing is surfacing some really long-standing chronic problems.
And a lot of those problems, as you mentioned, certainly were related to lack of adequate staff in the nursing homes, which, is something we've been advocating for a long time, but also, lack of preventiveness, lack of accountability. You mentioned in your article, and it's something also that we've seen, that infection prevention has been a long time chronic problem in nursing homes. One of the top deficiencies cited, and also the impact of ownership on quality and how that has really made a difference. And that's something that's not new to the pandemic either. It's a long time problem. So any comments on any of those things?
Yeah, I mean, I think one thing we know, right, is that nursing homes can be owned by a variety of different types of entities, right? They can be government owned, they can be owned by nonprofits, but the majority are owned by private for-profit entities. And unfortunately, private for-profit ownership status is associated with reduced quality of care. I mean, I guess that really shouldn't be surprising to anyone if you think about it, right? Because if you think about a key way to increase profits, it's to reduce the cost of your more
Right.
expensive inputs. And what is that for nursing homes? Well, that's nursing home staff, and especially higher skilled nursing home staff. And so we see this incentive, unfortunately, with some of these for-profit facilities to reduce staffing levels, especially of our more highly skilled staff, and quality suffers.
Right. Absolutely. And as you said, these have been long-standing problems. We've got the spotlight now on these facilities, on this industry. And you note in your article that despite this attention that's brought, to the forefront, the plight of residents, remedying the situation has proven difficult. And so what do you mean by that?
Well, I mean, I think the reality here is that there are very significant political barriers to improving the quality of care in nursing homes. It's not that we don't know what needs to happen to improve that care. It's that, unfortunately, there's still a profound lack of will to do it. And in part, let's be honest, that's because the nursing home lobby is powerful. It
Yeah.
makes major contributions to political campaigns. By comparison, nursing home residents are rarely in a good position to lobby politicians, let alone to make large contributions to campaigns. Family and friends can advocate, right? But many of the family and friends who really best understand these issues are pretty burned out from the caregiving work they're already doing.
Right. Absolutely. You talk about another issue with respect to ageism that has, really allowed this to happen. And that's something we're hearing and talking more and more about. And in fact, last year we had MT Connolly on as a guest who talked about
Right.
a recent book that she wrote looking at ageism. And it is one of the factors, that we're talking
Absolutely.
about here.
Right. Because if you don't see these lives as valuable, if you don't see these as people who are worthy of dignity and respect and care, then this problem, well, it doesn't seem as problematic.
Yeah.
And so, social attitudes toward older adults, um, and ableism, social attitudes to people with disabilities, are part of the problem. And here I think we really have a potent mix of ableism and ageism coming together.
Right. Absolutely. So what led you to want to write this article? What was your impetus for wanting to tackle this issue?
Well, a couple things. First, I had a terrific group of co-authors, three fantastic Yale Law students who worked with me on this and put tremendous work into it. Adriana Dugan, Justin Cole, Anada Al-Jassar, and they were wonderful people to work with. And it is always exciting when you can bring new talent into the space and help them see part of what's going on. But our goal together for this paper was to show that despite these very substantial political headwinds, right, the climate we were just talking about, despite these political headwinds that really do impede often new legislation, the law can still be used in new and creative ways to improve quality of care problems. So the reality is that there's already law on the books in the states and at the federal level that can be used to create much stronger incentives for high quality of care,
Mm-hmm.
and also to reduce the likelihood that nursing homes are operated by players who are likely to sacrifice resident well-being for that quick buck. And so what we wanted to do in this paper is show that even though there is a role for new regulations, new legislation, there are some opportunities here with existing law that we can leverage to make things better today.
And that is so true. And so let's talk about the opportunities that you've identified. And let's start with
Sure.
federal certification. As you know, all nursing homes that want to work through the Medicare and Medicaid program and receive money through there have to be certified by CMS. So talk about how that, let's talk about what that process looks like and a little bit about how this is an opportunity.
Okay, great. So as you said, right, before a nursing home gets the Medicare or Medicaid funds, and that's really the lifeblood of this industry, that nursing home has to be certified by the federal government. So the federal law that's relevant here requires the Secretary of Health and Human Services to have criteria for doing that certification, and specifically criteria to ensure that every home is administered in a manner that enables it to use its resources effectively and efficiently, and here's the magic language, to attain or maintain the highest practicable physical, mental, and psychosocial well-being of each resident.
Mhm.
And federal law requires the secretary, as part of creating those criteria, to consider nursing homes governing body and management. Well, that makes a lot of sense. I mean, if you think about it, right? Federal government understandably doesn't want taxpayer money going to homes that are not equipped to be run in a way that will allow them to meet federal quality of care standards, right?
Right.
And management plays a huge role in that. So then here's the rub. If we look at the current regulations implementing this certification requirement, they only establish two conditions related to ownership management. One, they require disclosure of certain identifying information, your name, your address. And two, they require facilities to have a quality assessment and assurance committee that has certain types of people on it. Well, neither of these requirements involves any examination of the qualifications of owners or operators or the past performance of facilities they already own or operate or have owned or operated.
Right.
So, yeah, so you have this current law that's requiring the secretary to certify homes only if they're administered in a way that can provide quality of care. But then the secretary certifying homes without actually taking the key steps you would need to take to ensure quality administration.
Mhm.
So this is a huge missed opportunity, right?
Mhm.
Because it's keeping money flowing to homes, flowing to entities that are operating, managing homes that have abysmal track records.
Right.
And it allows bad actors to take over even more homes without their history of mismanagement having any real impact on their ability to take additional taxpayer money.
And it's a lot of taxpayer money. And we're
It's a lot
talking
of
close to
taxpayer money.
$100 million a year goes into these nursing homes, right? It's a lot of taxpayer money. And so by re-looking at the certification criteria, CMS could put more stringent criteria in place that would ask some of these questions and get to the root of an owner operator's history, and then be able to accept or reject those that are performing well or not performing well.
Absolutely. So my co-authors and I recommend, that the secretary consider, and they could do this with existing authority, simply not certifying homes that are owned or operated by entities with a track record of operating facilities in a way that doesn't use the resources in the way
Mhm.
we need to ensure basically reasonable resident care. And
Mhm.
that could be an outright denial. That could be a presumption of denial. Um, and then we're not only making sure that the taxpayer money isn't wasted, is a real concern here, right?
Mhm.
But we're also creating a much stronger incentive for owners and occupiers to manage their facilities in a humane way.
Absolutely. And the funny thing, ironic thing about this, Nina, is certainly the criteria should be stricter. CMS already has the data it needs to be looking at some of this information. It already collects owner and operator data. It ties them to the nursing homes. It actually recently started publishing broader ownership data, and it has their own star ratings, the quality measures, the staffing data. So in addition to gathering information from the owners operators, it can be looking at its own data in order to make these determinations.
Absolutely.
Yeah. Well, so this is certainly one that we definitely support your recommendations to CMS and would like to see them increasing the criteria that they use with respect to initial certification and recertification for facilities that are up for recertification as well. So that's definitely an area they need to be looking at. So let's go on to the next suggestion that you made, or the next leverage point that you looked at, which is penalties from inspections. So let's talk about that a little bit.
Yeah, so under current federal law, we have authorization for fines and other sanctions when nursing home inspections reveal that a home isn't providing the care that they're paid to provide, or other problems are there that violate federal law. But here's the thing. Most of the time when problems are found, no penalties are actually imposed. And when penalties are imposed, they're typically really small. They're at the low end of the permissible range. And the more consequential penalties that the federal government could impose, like denying payments for services, or saying we're not going to pay for people who are admitted after this problem has arisen, well, those are rarely used. In addition, when facilities are caught with their pants down, right, they usually can just pull up their pants. Right? They're given the opportunity to fix the problem. Sometimes no one even checks to make sure they really did it. So we really need to change this approach, because when penalties are this low, what happens is they can just be treated as a cost of doing business.
Right.
And they don't actually deter bad behavior. So we need to flip that, right? We need to make it more costly for facilities to do the wrong thing than the right thing. And unfortunately, the incentives are not properly aligned right now. And taking full advantage of the penalties that federal law already authorizes is one way to better align the incentives.
Absolutely. It's one of the huge, I think, failures of the system, in the sense that they are not using the full range of remedies that are available to them. And the fact that when we talk to CMS and look at the penalties that are put into place, civil money penalties, to the extent that they're used, and as you said, they're very low. I was actually interested, as what you showed in your article was that CMP, civil money penalties, are used 72% of the time when deficiencies are found, with which penalties are actually imposed. That's a really high number, and yet it's either that or termination that's being proposed by CMS. But these other remedies not only would, I think, help improve care for residents, and also, but keep them in place too, instead of having the threat of termination and having threats of closure, all of those other things that really, put residents at risk. Having that full range of remedies in place could actually help benefit quality care.
Absolutely. Although I do think sometimes the threat of closure is made out to be more of a boogeyman than it actually is, right? Because at the end of the day, it doesn't do residents a favor to
Right.
continue to put residents in facilities where we know they will be neglected. And so while certainly closure can be a real problem for current residents, it's also important to remember that you don't want to prop up organizations that really aren't equipped to meet people's needs.
Right.
And there's a role for ombudsmen and others to support residents if a closure happens.
That's
So we
right.
need to be talking about that too, and not all assume that all closures are going to occur under worst case scenario conditions.
Right, absolutely. I love, one of our, colleagues has always said, if an owner operator is not adequately meeting the residents' needs, let's look at how we can change them and not necessarily have to have residents move. And sometimes that does happen, but if there's a way to put in monitoring or temporary management, or really put, more strict provisions on an owner operator to help change that practice instead of forcing a resident to move, we should be looking at those opportunities.
And we're just leaving a lot of these valuable tools on the table and not picking them up, even when they would be the right tool for the job.
Absolutely. You reference in your article that the National Academies for Science, Engineering, and Medicine, which released about almost 2 years ago now, a study of nursing home care, that they even talked about the need for stronger enforcement in long-term care facilities. And actually, one of the members of that committee is formerly with the GAO, who has testified to that fact before Congress about, like, let's actually put stronger enforcement provisions in place. And that's one of the things we really haven't tried as a country, is to put strong enforcement in place and to have these remedies work and use them.
As I said, I think we have a pretty good idea of what can be done here. The question
Mhm.
is, do we have the political will to do it?
Yep, absolutely. Well, that's certainly something that we can be advocating around as well.
Yeah.
And the need for improving enforcement so that it does not become a part of doing business. And I just appreciate you mentioning that, because that's something we hear a lot from the advocates that are working directly with facilities, that they'll say this, it's just one of the costs of doing business, and I'll take the fine instead of changing my practice. And that is something that we cannot be tolerating. So let's look at the third leverage
Sure.
that you have proposed in your article. And we're looking now at state licensure. So let's talk about that a little bit.
Sure. So before a nursing home is opened, or when there's a significant change in the ownership of a facility, the owner must apply for a license from a state licensing agency. And what we suggest in the article is that licensing power could be a powerful tool to improve quality, although right now it's largely sort of a formality, if you will.
Mhm.
So, just to dig a little deeper, one of the big opportunities we see here is that states could refuse to license facilities with a track record of poor performance, or refuse to grant new licenses to entities with a record of bad behavior, say from other facilities.
Mhm.
And if you considered the performance of the individual facility being licensed, or of the entities that own or operate that facility, when you're deciding whether to grant a license, or to renew a license, or to suspend or even revoke a license, right? Then you create a very different incentive for owners and occupiers, but you also reduce the likelihood that in your state there are facilities operating in conditions where they cannot meet residents' needs.
Mhm.
And a lot of this is already on the books, right? So in many cases, state law already actually gives licensing agencies the ability to do this. Some states do require the licensing body to consider past performance of operators, in terms of other homes they've owned or operated when they're applying for a new license.
Mhm.
But even those that don't, most would allow the licensing body to consider this. And similarly, when we're talking about renewal of license, even those states that don't require past performance to be considered, well, state licensing bodies really, by and large, have the authority where they could choose to do that.
Mhm.
And so you could transform this licensure scheme, which taxpayers are paying for. It's not.
Right.
You could transform the scheme to one that could be used to drive quality, right? To stop known bad actors from acquiring new homes, right? And I think this can be a very powerful tool, and is a way to think about, how do we, in our advocacy efforts, move beyond exclusively advocating at the federal level, to think about
Mhm.
where are there state actors who have the ability to help improve the system where that
Right.
ability is not currently, being used.
Right. Right. And I think this is such an important one. I think for a couple reasons that you said. One, certainly because it's something that isn't a federal response, but a state response where states can be proactive in also looking at the quality of care that's provided in their facilities and taking proactive action here. But also because looking at state licensure, and you list in your article some examples, and we've seen a lot of news reports of examples of facilities where they have failed residents, um, and there have been instances where it's led to not only residents suffering, residents being moved very quickly, but also lack of appropriate use of federal and state dollars in terms of the care that's being paid to provide for people, and also leave states on the hook for stepping in when
Mm.
some facilities fail. And a few years ago, the Skyline Company is one
Right?
that, failed very widely across the country. Several states had to step in and take over facilities or put receivers in place because
Sure.
the company failed. Most recently, we've seen instances in Missouri, for example, where an owner operator just stopped paying and literally was shut a facility down overnight, leading to a lot of chaos and bad outcomes for individuals and staff. But these things could be prevented to a large extent if only we were looking at and requiring information about ability to operate, financial solvency, looking at quality issues, kind of looking at all of those factors, both on licensure and on relicensure applications. Wouldn't you think?
Absolutely. Right. So this is preventative medicine, if you will.
Right,
And we have it. Let's not leave it on the shelf.
right. Absolutely. So there are a number of things that can be done. And while we are talking about state by state action here, we do know that, states look to each other for best practices. And, if you do start seeing best practices in one state, that starts to then multiply across states, and we could get, some better policies. And frankly, the licensure could then impact the certification process as well that we talked about initially in
Right.
terms of how CMS is evaluating these facilities
CMS
here.
is largely relying on licensure as a proxy for quality. But if you look
Absolutely.
at how licensure is occurring, right, that's a mistake because it's really not getting at quality in the way that it could, in the way that it should.
Yeah. I love your recommendation that you suggest that states create a rebuttable presumption of denial for applicants that have a poor history. And can you talk about a little bit what you've included in there?
Right. So the idea here is that we start with the assumption that if this applicant has mismanaged other facilities, you don't give them a license for a new facility, right?
Mhm.
Now, what could that mismanagement be? Maybe they've had their license revoked somewhere else or suspended. Maybe it's a voluntary surrender. Maybe they've been put into receivership. Maybe they have facilities that are special focus facilities, right? You could think of a lot of, what the individual state wants to do there that are their best indication of this is a problematic owner operator. And then you're giving extra scrutiny to those facilities, and you put the burden on the owner operator to show, no, here's what maybe happened in that other facility. Here's what we're going to do differently. Here's
Mhm.
why you state should take that chance on us, right?
Mhm.
And give that some additional scrutiny. Because right now, and it's sort of a no-brainer type of option, that's just not happening.
Right.
But we do know that, when state licensure agencies put additional scrutiny on applicants, it can make a difference. And I'm thinking of a situation around 2021 where Vermont's licensing entity started asking questions when a number of facilities in the state were being shopped to an actor with a history of some real serious problems. And ultimately, that deal did not go through in large part, I understand, because the licensure agency was engaged.
Mhm. So that's a great example of where it definitely can make a difference for the residents in those communities. And
Absolutely.
to attract, the people that are getting into it, in order to ensure that, residents are being well cared for, and are getting into it maybe for the right reasons, right? Not
Yeah.
just to turn a quick profit, at the expense of the people who are being served.
Yeah. The goal is not to drive all profit out of the industry.
Right.
The goal is to make sure that when people are profiting, they're profiting from providing good care to residents,
Exactly.
and not profiting at the expense of providing good care to residents.
That's right. Absolutely. The last lever that you mention in your article is related to federal mortgage insurance. And this one I think is not as is one that maybe not many people know about, outside of the industry itself in terms of how this works. So can you talk a little bit about the HUD program and what this means?
Yeah, this is serious inside baseball, isn't it?
Yeah.
Um, So the federal government helps subsidize nursing home facilities by guaranteeing certain loans made to them. And specifically, Section 232 of the National Housing Act directs the Secretary of the Federal Department of Housing and Urban Development to provide mortgage insurance to new or rehabilitated nursing homes. And this program uh, could be used to encourage nursing homes to engage in practices associated with higher quality care.
Mhm.
Unfortunately, it appears that it may, if anything, be rewarding the opposite.
Mm.
And I'm now working with one of my co-authors and another partner on sort of digging deeper into this program and trying to really map on, okay, where are these funds going and to what nursing homes? But what we do know is that as currently structured, the program does not create any meaningful incentives for better care. So when you're pushing out taxpayer money, the question becomes why, right? And what are you getting for that taxpayer money? And if you're not getting a better nursing home, then you might want to ask, well, why is it being done this way?
Right.
And just the irony of this program too is actually you're not even eligible for mortgage insurance under Section 232 unless you have at least 20 beds.
Wow.
So at the same time that we're seeing advocates, including the Biden administration, seizing on the idea of small homes as a way to drive a quality of care, better quality care,
Right.
won't even insure those.
That doesn't seem to make sense, does it?
No.
Right. So looking at this option, I noticed that you had written that, not only are small operators not eligible for this, but they also show preferences to for-profit facilities. They show and they really don't look at quality issues. So
Right.
and what we also know, based on not only what you've written in, but also other research, is nonprofit nursing homes generally have higher staffing levels, generally provide better quality care when you look at the data, and yet they also are not listed as preferential in these scenarios.
Right. So nonprofits can certainly get Section 232 funding,
Mhm.
but there's reasons baked into the way the program is administered, among other things, that seem to be leading to these disproportionately going to larger for-profit facilities, and not larger for-profit facilities at the higher range of the quality
Mhm.
spectrum, but more toward the lower end of the quality spectrum.
Mhm. So certainly, HUD, the Housing and Department of Housing and Urban Development, right? Sorry. They certainly can be relooking at their criteria, in terms of guaranteeing, which are significant amounts of money that are being put into these programs. I don't recall, offhand, I do have it here, how much was being guaranteed In 2019, you had said, 2019, more than guaranteed $20 billion in mortgages for 2,300 nursing homes is what one of the articles that you referenced in your paper said. That's an enormous amount of money. That's a large number of nursing homes. And with good criteria, we can be demanding more out of the facilities where this money is being guaranteed by the federal government.
Yeah, I think in 2021 you were making commitments for over 4.9 billion in loans.
Mm-hmm.
So that's over 400 facilities. And
Mm-hmm.
so the question is, okay, we have a program. How can we use that program to further the public interest?
Absolutely. And so looking at not only quality in the facilities, but also looking at the facilities, whether it's being in terms of rebuilds or renovations, that are promoting practices that we find desirable, such as single rooms, for example. We're talking a lot about,
Right,
wanting to transition nursing homes to private rooms or single rooms. Certainly because that's what most people want, but also because it's safer
right.
instead of having multiple people, living in one room. So looking at, what are the practices that we are desiring and encouraging facilities and prioritizing them in guaranteeing loans for those operators and owners.
And at the very least, maybe getting out of the way of some of those improvements, right?
Right,
Not making it harder for nonprofits than for profits to get insurance, not limiting insurance to those larger operators, right? That's almost just getting out from being in the way of yourself.
right. So, Nina, I mean, it sounds like, certainly as we continue the advocacy that's needed both to improve quality care, to look at reforming nursing homes, at looking at improving the way long-term care is provided in nursing homes, there are a lot of functions that we can be looking at right now in terms of the authorities that are given to both state and federal governments that could really make a big difference.
Absolutely. I mean, I think, one thing we want to make sure people understand is that, yes, these are complex regulatory schemes. And I think, the complexity of the regulation in this space, the number of overlapping entities and overlapping laws can really stymie advocacy because it's hard to
Mhm.
sort through, right? So one thing we're trying to do here is help disentangle this for folks to think about where the
Mhm.
leverage points. But don't let that complexity get in your way. Recognize that there are part of what that complexity gives you is multiple points of leverage,
Mhm.
right? That reform can happen both at the state level and at the federal level. Realistically, we want it to happen at both levels.
Right.
Um, and I think it's important to remember that there are multiple types of actors that can be held accountable in this space. Right? Is it important to hold elected officials accountable? You bet. But administrative agencies, regulators, right? We also need to hold those entities accountable
Right.
because in many cases there are existing statutory and regulatory authority that administrators could use to really improve quality of care in ways that matter for human beings.
Yeah. Absolutely. Well, certainly, in the advocacy that we're doing at Consumer Voice, where some of those things, as I mentioned to you before, are things we certainly have been advocating for. You've given us, I think, additional fodder and tools that we can use to continue our advocacy in this area. So I thank you for that, and thank you for walking through these for me and for our listeners today, because I think it's certainly something that all advocates can be looking at these opportunities and can be working on them at the state level. They can be working on them in terms of promoting better quality at the federal government as well, and certainly we'll look to be working together with them on these and with you as well.
It's an all hands on deck type of situation.
Yeah.
But I'm grateful for the work that you do, Lori, and that ombudsmen and advocates all around the country are doing to try to make the lives richer, better, safer for nursing home residents.
Absolutely. Well, Nina, thanks so much for joining us today and for talking about these important issues and for continuing to push the envelope and to be studying and working on these important areas. So look forward to continuing to work with you on that. For people listening, if you'd like more information about the things that we've talked about today, you can get it on our website at www.theconsumervoice.org. We'll also, I know we've referred to this article in some of our social media and in our newsletter, but we'll do that again so that people can access it. And Nina, look forward to talking to you again soon. And thanks for joining us. And thanks to all of you for listening today.
Thanks for joining us on Pursuing Quality Long-Term Care. This podcast is a program of the National Consumer Voice for Quality Long-Term Care. Make sure to visit our website, theconsumervoice.org/pursuingquality, where you can subscribe to the podcast, follow us on Facebook and Twitter, and find more information and resources. If you enjoy the podcast, please rate, review, and subscribe. Thank you for listening, and we'll see you next episode.